Good morning. Good morning, everyone. I know last time wasn't a very happy talk, and this one is going to be a little bit better, I hope, or leave you feeling a little bit better, and there's a lot of information in what I'm going to talk about today. So I want to not rush through, but I want to get through in time so we have plenty of time for questions and answers. Okay? Remember that our topic has been learning and memory, and so I've tried not to go off on tangents related to other things in neuroscience. The brain is awesome. Okay? It's just awesome. And we're covering a teensy part of that awesomeness in our lectures. Okay? So, just to review a little bit, like you could ever forget, Alzheimer's destroys memory. And it destroys memory because you lose neurons in these higher order cortical areas. So what we have, this is the Alzheimer's brain. This is an age-matched control. So this is a person of the same age who died possibly in a car accident or something. And you notice that prefrontal cortex here is diminished in size. The neurons are gone, so it's smaller. Working memory is gone. The temporal lobe, which is down here, underneath on Fred here, rolled underneath is the hippocampus, which is involved in short-term memory and is important for memory to go on to be consolidated. The hippocampus is gone relative to the normal. And last of all, you have multiple cortical areas all over that are involved, which is responsible for the loss of the long-term memory, which is encoded more generally in the brain. Now, one of the most important things I can say to you, our topic has been learning and memory. So I focused on that. This disease actually affects many other areas as well. Okay? This disease is not limited to the cortex of the brain. It's just that this is where the learning and memory is involved. So we have areas of the brain in Alzheimer's that are down in our brain stem, so down in the lower areas of our brain that control attention, sleep-wake cycles, mood, all kinds of other things that are regulated by nuclei or areas of the brain that are also involved in this terrible disease, and they degenerate. So this is a very, very complex disease that involves the loss of neurons in many different areas and presents itself in the Alzheimer's patient. I do want to come back here to the cortex to remind you of one thing, and that is that it's the higher order areas which are lost in the cortex. So it means that the person can walk, the person can see, the person can hear, and the person can feel. They just can't make any sense out of any of it. So when you and I look out in the world, we don't just see, we make meaning of our world, and that meaning directs our actions. And that's precisely what they lose. So it's a terrible, terrible disease. And there are many disorders, you remember, that can cause loss of cortical neurons or interfere with learning and memory. And I've just focused on Alzheimer's because all of us of the age that we all are very concerned about this disorder. Many of you have family members who have this terrible disease. So I focused on it as an example. Now, on a cellular level, and you'll hear about this in the news, on a cellular level you have an accumulation of particular protein. It's called tau protein, it doesn't matter what it's called, but that the neurons get filled with it, and that's what makes these neurons dark. They're stained with a specific stain that stains for that. And so the neurons are destroyed, and once they're gone, they're gone. And there's a major exception to that. We're going to talk about it a little bit today. But nonetheless, neurons throughout the brain, again, are lost, mostly in the neocortex. Then extracellularly, meaning outside of the neurons, you see these big plaques accumulate. So these are called neurofibrillary tangles, and these are called the plaques of Alzheimer's disease. And you will hear about these. We have animal models in which we can do things that will cause these to be deposited in the animals' brains, and we use that to study the disorder and to look for ways that we might cure the disorder or help individuals. To date, this has been very promising, yet very unfulfilled promises, and there are probably reasons for that. And I will come back to that at the very end if we have time. I also want to make a point that I didn't go into a lot of the details about the cellular level or the molecular level because most of you have not had biochemistry. There are a lot of other changes which take place which are devastating, okay? There are other kinds of cells in the brain that are involved in a disorder like Alzheimer's, so I don't want to leave you just thinking there's a few neurons in the cortex and these are the only thing involved. It's a very, very complex disease, and that's one of the reasons that it's very difficult for medical science to know how to stop this and what to do. So there are many other changes on a biochemical level that are taking place. Now, I put this in here. This is from the Alzheimer's Society, provided this for me to show you. And it simply shows that between 2000 and 2008, we made huge advances in being able to change the number of deaths from different disorders, from breast cancer all the way to HIV. And I want you to see the difference in Alzheimer's. And what we're going to talk about today are the possible causes for this, okay? And that it informs us about how we might change our lives so that we reduce the risk as much as possible. But I wanted to show this to you, not to scare you, but to give you an idea of the progress that's made here. And in a very complex disease involving the brain, we're in trouble. Okay? And the baby boomers like me, you know, are very concerned about this, okay? All right. This I wanted to show you for a different reason, and that is, like you didn't already know this, okay? This over here, these graphs are young people, the white ones, and the black ones are older people. So what you see, and this is from the aging hippocampus. There are many people who spent their entire lives studying the hippocampus as part of what I did in my own research laboratory. Trials to criterion mean how many times do you have to practice something before you learn it, or how many times does an animal have to practice to learn it, or whatever. And you see that when you're young you don't need many, and when you're older you need a whole lot more, okay? Over here, it's while you're learning something, how many errors do you make? Okay? And you see that the young make smaller number of errors and the elderly make more. What I'm going to talk to you about today is how you can reverse this. How you can bring this down to about here and bring this down to about here. Okay?
Even now.
Even now, yes. Even now, okay? So I'm going to tell you about research that indicates that this is not something that is natural that happens as we age. That there are reasons why it happens, and most of these things are under control. So that's my message for today, okay? Remember the hippocampal formation down here. There's one on this side as well, but I just highlighted this one so you could see where it's at. It's a tiny area. It's one of the areas we focused on because it's one of the areas that's involved in stroke, cerebral anoxia, all kinds of neurodegenerative diseases, lots of other things that can cause problems with learning and memory. Okay? So I focused on it, and this is just a little seahorse lying down so you can see why the old guys thought it looked like a seahorse. It still doesn't look like a seahorse to me, but whatever. Okay? So we've kind of focused on this, and I'm coming back to it because scientists can't study a disease like Alzheimer's disease in its totality. You have to pick some structure in the brain and look at it and see what changes it or how it works better. So we have most of the information as far as brain structures has been generated about the hippocampus. It's an incredible structure and very beautiful, a very beautiful structure. So let's go back, review some things, and tell you some new things that you didn't know. Okay, it's an old cortical area. What does that mean? It means that it has only 3 cell layers rather than 6. Okay, that's just how it's defined. It also means that it's seen in all animals that have cortex. So it comes about early in phylogeny. And so we still have it, and it's critically involved in learning and memory in our brains, just like it is in the lower animals. It's considered one of the most plastic and vulnerable areas of the human brain. Plastic means it's one of the areas that undergoes those synaptic changes when we learn something. So it's very plastic. It means it's labile. I can make new synapses. I can withdraw synapses. I can make some synapses more efficacious. I can do all kinds of things. It's very plastic. But that plasticity, we think, makes it vulnerable. And vulnerable to lack of oxygen. So it's one of the first areas of the brain to die if your brain gets cut off from oxygen. It's vulnerable in diseases like Alzheimer's and other diseases as well. It's one of the areas that's affected by alcohol. It's affected by all kinds of drugs, cannabinoids, what you would know as marijuana. It's vulnerable to any kind of insult. It's a very sensitive area. Okay? So it matters since it's involved in learning and memory if you want to keep your memory intact. Now, changes in hippocampal volume mirror those changes we just talked about in behavioral performance. So you see how the elderly people have to take more trials to learn something and they make lots more errors? Well, their hippocampus is smaller. And they're correlated with each other, and we think there's it's actually causative, but there's a correlation between these two things. Now, here comes the big one, guys. You learn nothing. You walk away from this class knowing this. The hippocampus is one of the only areas of the brain in which new neurons can be generated throughout life. Okay? Now, having said that, a logical question would be, if that's true, why don't new neurons just take over when somebody has a disease like Alzheimer's or when somebody has some kind of insult to the brain? Well, it doesn't increase neurogenesis in response to disease. It generates a low level of neurogenesis throughout life. Some things decrease it, some things increase new baby neurons to be born. I also want you to think about this. If the hippocampus is involved in learning and memory and you need to process things through that structure for long-term memory to take place, if you lost neurons in the hippocampus, a new baby neuron wouldn't replace those memories. A new baby neuron has to make its own connections and memories, right? I mean, you can look at it that way, okay? And so we want to know what things diminish this capacity, and I will simply tell you stress is one. Remember I told you that chronic stress increases cortisol throughout the body in response to this chronic stress. And so that cortisol binds hippocampal neurons and it also decreases neurogenesis in the hippocampus. If you're under chronic stress, you have less neurons being born in the hippocampus than otherwise. Another thing which decreases it, and we actually think it's due to chronic stress, and that is mental disorders like depression. So depression actually decreases neurogenesis in the hippocampus. And today we're going to talk about something that increases neurogenesis in the hippocampus. Okay? Factors that increase risk. So before you look at that long list that we're going to talk about, what I want to do, two things. I want to remind you that there is an early onset form of Alzheimer's disease which is transmissible. So you have genetically inherited disorder. So it is an autosomal dominant pattern of inheritance, which means that if you get the gene, you get the disease. But only less than 10% of all cases of Alzheimer's involve this. Most all of the cases of Alzheimer's are what we call sporadic, meaning they're not transmitted from a person to their offspring. And so it doesn't mean there aren't predisposing genetic factors. It means that there's no specific gene. And by the way, even for the type of Alzheimer's which is transmitted in a heritable fashion, there's multiple genes that have been identified. So it's not even a simple pattern in that sense, okay? Now, we're going to talk about sporadic Alzheimer's because that's what 95% of people who get this disorder have. So that's what we're going to focus on, okay? So up here, what is a major factor that increases risk? So the second thing I want to mention is risk. Risk is exactly what that word means in the common everyday language. There are multiple things that increase or decrease risk. They don't cause it, they change risk. Okay? So it means that if you did all of these things, you still might get, you might not get Alzheimer's disease, although if you live long enough, you probably would. But my point being that it's a risk issue. It's not that one causes it. So here we have age. Well, people who are older are the ones most likely to get it. Although I think one of my colleagues at Vanderbilt told me the youngest person that they've identified, at least at Vanderbilt, that had the changes in the brain that indicated the person probably had Alzheimer's was 13. So this was clearly of the early onset form, a genetically transmitted form. It does occur in younger people. It's very rare, obviously. Okay, individuals who have Down syndrome or trisomy 21. There is on the 21st chromosome, one of the areas in that 21st chromosome is also involved in Alzheimer's disease, and most individuals who have Down syndrome who live past the age of 30 develop changes in their brain that are indistinguishable from Alzheimer's. Inheritance of the E4 alleles for apolipoprotein E, which I didn't even bother to spell out for you. So let me tell you what this is. This is simply a molecule that helps transport cholesterol. And you need a certain amount of cholesterol in your brain and in your body for normal function. So we hear cholesterol is the bad guy, you know, cholesterol, stay away from it. Well, your liver makes it normally because you need it to make membranes. And this is one of the molecules that helps transport cholesterol. Okay? So it's not a bad guy by itself. There are variants of this, though, so ApoE comes in a variety of forms. I think that would be the easiest way for you to look at it. And the E4 alleles, which is one type of the ApoE, increases risk for Alzheimer's, okay? And I could go into detail about this. We don't really have time. We are learning what that might be potentially about. And again, if we have enough time and someone has an interest, I'd be happy to address it. I want to, if you have one E4 allele, it increases your risk a little bit. Okay? If you have two E4 alleles, which means you got one from mom and one from dad, so you have two, it increases your risk even more. These are risk factors. It doesn't mean that you'll get it if you have an E4 allele. It just increases risk, just like age does, okay? Head injury, we've talked about this before. People who have head injury are at increased risk for the development of Alzheimer's. Does that mean that you'll get it because you had a head injury at one time? No. You have one head injury, it increases a little bit. You have multiple head injuries, increases the risk more, okay? High-fat diet, elevated cholesterol, obesity, smoking, high levels of homocysteine in the blood. You're going to notice something here. These are all risk factors for heart disease, okay? Atherosclerosis, diabetes, hypertension, okay? These are all risk factors for cardiac problems as well, and in fact, most of these things here, not all of them, but most of them are also risk factors for cardiac disease or heart disease, okay? And this is very significant. Once this was determined, scientists sat back and said, whoa, the same risk factors for cardiac disease and a brain disease like Alzheimer's, what might that tell us about the pathophysiology of this disease and the etiology of it? What causes this disease? A lot of these factors were in fact discovered through a very famous study called the Nun study. So we had these women in convents who were living to be like 104 and 106. They were sharp as tacks. Okay, they were learning foreign language. They were learning Russian at the age of 104, and they could argue politics with the best of them. And people noticed this, and it was like, yo, you know, what are they doing that's so different and everything? Okay, so a scientist went to these women and asked them if they would be willing to give their brains to science when they died, and they agreed to do it. And multiple convents were involved in this. And the last time I knew about it, there were nearly 1,000 brains from nuns in various convents. And scientists looked at the brains in a double-blind way, which means they didn't know whether that particular nun had dementia or didn't, or had any kind of mental problems or Alzheimer's disease or whatever. One of the things that was noticed was that in these convents, the rate of Alzheimer's disease was significantly less than in the general population. So it's one of the reasons we wanted to study them, because what were these women doing that was so different that, you know, they're from all walks of life, all races, all ethnic groups, whatever, you know, what's happening here? So one of the things that was discovered, and again, this just took the scientific world really by surprise, okay, was that the only women, only nuns, that showed evidence of dementia or Alzheimer's disease were those who also showed evidence of infarctions in the brain, which means they had small strokes. So it turns out that we now know that the same risk factors for heart disease and stroke are the same risk factors that predispose you to Alzheimer's disease, and that should be a wake-up call. Okay? And it may help explain why it's in Western nations that the rise in Alzheimer's disease is off the charts, because so is heart disease, so is stroke, so are the other disorders. They're associated with bad arteries and us having terrible eating habits and terrible exercise habits. You know where this is going. Okay, so history of untreated depression is a risk factor for Alzheimer's disease. And we think part of that is if you're depressed, you're under chronic stress, you have chronic activation of that, what we call the hypothalamic pituitary adrenal axis, and that this actually kills neurons in the brain. Cortisol kills neurons in the brain. So it's meant to respond to a challenge, to a threat to your life, you know, now like this. It was never meant to be a system that was activated chronically. We live in a very stressful world. And so just aging causes a lot of stress. Is there anyone here who would deny that? Okay. Hormone replacement therapy. Wow, this was a big one. So way back when I was teaching medical students, studies started coming out and saying that you should give women hormone replacement therapy after menopause because it decreased dementia. Well, then the Women's Health Initiative looked at these huge numbers of studies, and they were analyzing their own data, and they said, oh no, it actually increases dementia. Okay? So here's what the final outcome is, at least I think it is at this point. I talked to my gynecologist about this. The Women's Health Initiative, the women who had an increase in dementia weren't started on hormone replacement until after the age of 65. Okay? We actually don't know whether it increases or decreases dementia in women who were started on it in the perimenopausal period. And so gynecologists don't know what kind of advice to give a woman. Can you imagine the responsibility when some woman comes to her physician and says, should I do this or shouldn't I do it? And if you're wrong, you may have, you know, predisposed this person or increased their risk factor for developing a terrible disease. So doctors carry this ethical kind of, this is why they need to know about the research literature and why they spend all this time studying, is so that they can give the best advice to their patients. I'll tell you, there's a recent study that's just come out that suggests that there's a relationship between hormone replacement and levels of estrogen and whether or not you inherit an E4 allele. That if you inherit an E4 allele, this risk now is greater if you take hormone replacement as a woman. So that it looks like the E4 allele inherited by women puts them at greater risk than the E4 allele inherited by men. And in part, that's related to estrogen in women. So we're all trying to keep up on the literature, with a very complex disease, okay? So file that away when you hear things on the news and don't pay much attention. The news grabs a hold of something, you know, we got a cure around the corner for this, that, and the other thing. And scientists are much less likely to pay much attention to that, okay? These are very complex disorders. Diagnosis of mild cognitive impairment. Mild cognitive impairment in the clinical sense of that term, not in the sense that the lay public might use that term. So the lay public might say someone who's having little problems shows mild cognitive impairment, just the use of those words in the common lay public. A physician uses the term MCI differently. Clinically, it is a person who shows significant memory problems without any other impairment in cognitive ability. So it's a person who at some stage clinically can be shown to have significant memory impairment but no other signs of any kind of like intellectual decline or cognitive decline. That's a clinical thing. Some studies say 60%, some say 100% of people diagnosed clinically with this will go on to develop Alzheimer's disease. So right now, the big emphasis is to get people who have this diagnosed accurately, get people at this stage and see if we can try to reverse something or delay the onset of Alzheimer's disease. And I think a lot needs to be known about this. Low vitamin D levels, it's still in the literature. I don't know of anything that says it isn't true. Most of us get plenty of vitamin D, but people who, for one reason or another, do not or can't process a cofactor or something have a lot of problems with this. So again, there's complexity on a biochemical level. These are factors that increase risk. Okay? Well, you know, most of them are all the same things that increase risk for heart attack and stroke. Okay, so let's look at some things that decrease risk. You like that? Okay, this is why you came today. Okay, decreased risk. This is what we care about, and these have been shown by controlled studies. Good genes. Well, you can't really do anything about that. You know, that's over, guys. Okay, that was over a whole long time ago. Okay, continuing mental challenge. Now, this came out of studies that said that university professors and people who were musicians and people who were professionals had a lower incidence of Alzheimer's disease. And so it's like, whoa, you know, what does this mean? This led to the idea people who have these kinds of careers also recover faster from stroke, which is basically, you know, a heart attack in the brain. So, you know, some kind of ischemic or cut off of blood supply to your brain. They also recover better from stroke. So what's going on here? It's led to the idea that people who challenge themselves mentally are constantly making new connections and multiple connections for the same thing. So their memories are generally better because they have more associations with something than other people do. So people of higher intelligence, which we hope are found in those professions, but not always, okay, find perfectly intelligent people in all professions, that these individuals, if they challenge themselves mentally, and if each of us do that, like you are by attending Osher classes, you're challenging yourself. That you have stronger associations, you're constantly learning, and that synaptic plasticity is taking place. Okay? So cognitive reserve has come to mean something very real. I changed the font here for challenge because I need to tell you about something. Challenge means that you actually have to concentrate on what you're doing. Okay? Challenge. Like learning how to play a musical instrument you have never played before, or trying to reach another level of excellence. Learning a foreign language. Doing something like that. It does not mean doing something that you've done for the last 25 years and doing it more. You'll just get better at doing that thing probably, or maybe not. But and a new study has just come out saying that a lot of these companies that are selling all these things, you know, to try to, you know, tap into synaptic plasticity. I love it when I hear these ads. You know, I'm like, wow, you know, I'm impressed, okay? 50 million people in the United States have bought these programs, which cost a fair amount of money. 50 million. And the recent study come out says there's no evidence whatsoever. Okay? It says that what the programs have you do, you get better at those things. But most of us want to be better in general in our lives. And so what we need to do is we need to challenge ourselves. And you don't need to buy something to challenge yourself. You can challenge yourself by joining a book club where you're responsible for telling other people what the thesis of the book is and what it means and what it meant to you. Challenge yourself. Musical instruments, foreign languages, these are always given because these are a challenge to learn, as anyone here can testify to if you've ever tried at my age to learn something like Russian. Okay? So it is the challenge, the brain responds to that challenge. Okay? So that's really an important part of this. Maintaining strong connections with others. Part of these things here will also glean from the nun study. How did these women live? Well, their genes were probably no different than a random assortment of people in the general world. But wow, were they big on mental challenge? You think of a 104-year-old woman learning Russian or something, and you could say, well, why bother? Is she ever going to talk to anybody who speaks Russian? Okay? Well, you know, that's not really the point. She was enjoying what she was doing and doing it well. The people who interviewed these women said that they would walk away, and for days they were just in this mist. They just couldn't believe what these women could do. These women sit around tables and argue about politics and could present arguments for things and think about how the world could be made better, and just sharp as tacks. So the scientists were impressed by the level of mental challenge these women were putting themselves through every day. They have strong connections with each other. These women live in a community with each other, and they share a value system. They share a belief system that's important to them. They care for one another. They're separated from their families. When one of these women is ill, the other women care for them. There are strong social connections that are really important. Healthy diet. These women, in most of these convents, they raise their own food. They stay close to the earth. They have excellent diet. Very rarely was there an obese nun. Very rarely was there somebody that had the disorders that are associated with that, like, you know, diabetes, type 2 diabetes anyway. So these scientists noticed this. These women were living very differently from the general population. And we now know by controlled studies that, in fact, these things are important. The one thing that has come out of all the studies is the one most important thing you can do for your life to decrease risk for Alzheimer's disease. And it also decreases risk for heart disease and stroke is exercise. The one thing you can do. The one thing under your control. Now, in the nun study, what did we find? Those women participate in some kind of exercise every day. They were doing yoga. They're doing all kinds of things, aerobic exercise, walking, doing this every day with each other. Strong social connections and doing things with each other and eating well. About exercise. First of all, do not misunderstand me. Do not go out and be a weekend warrior and have a heart attack on me, okay? Whatever you're doing, you should increase it if possible, but under the supervision of a physician. If you are sedentary or have been sedentary in your life, you need to be under the supervision of a physician who can tell whether or not what you ought to do and the rate at which you ought to do it. Exercise means many things, and so let's talk about this. One thing it means is aerobic exercise. And aerobic exercise is where you get your heart rate up to a certain point. And this is why when you're older, it's very important not to just go out, you know, and mow 10 acres, you know, with a push mower or something, okay? That's just a prescription for a heart attack, okay? Because the increased demand on the heart in the heart that is not healthy or vessels are not healthy will lead to heart attack or stroke. But aerobic exercise increases the health of your blood vessels. What is a major cause of decreased learning and memory? Problems with blood flow to the brain. Okay? You want to keep your arteries healthy. Well, it's also a risk factor in Alzheimer's disease. So you need to have exercise 2 or 3 times a week that keeps your heart rate up to a certain level. And usually they recommend aerobic exercise, usually about 3 times a week for 30 minutes at a time. Now there's some studies that say if you do it only for 10 minutes, 3 times a day, that it's fine, that works out fine. I mean, there's lots of stuff out there. The point is do it, okay? First check with your doctor and then exercise, increase whatever you're doing now. The second thing that often gets forgotten about as we age is that you need strength training. And strength training a couple days a week can improve the quality of your life enormously. It improves the quality of your life. It decreases risk for Alzheimer's. But even if you were to do all these things and you got Alzheimer's, the quality of your life before that time would be improved. And this means working against resistance, whether that's weights, machines, or your own body weight. And in addition, do not forget your core. This is one thing, like people go to the gym and they work, they do this or that, but they forget about their core. Your core are the muscles that help hold you up against gravity. There's nothing that makes us look older than poor posture. And poor posture and backaches largely come from a weak core. So you notice that your abdominal muscles, back muscles are weak, again under the supervision of a physician. If you want help in getting going after you get the okay from your doctor, there are plenty of personal trainers out there. Many people can give you advice as to personal trainers who are very good and work with older people and do a very good job, okay? So don't forget your core, do that strength training. As we age, we lose muscle mass. And so now we need to do the strength training to offset that and to help with other things. So, you know, there's lots of changes going on in our body. And you'll look better, all right? You'll look better and you'll feel better. Okay. And the last thing, do not forget. And that is a part of a healthy plan is, in fact, flexibility and doing stretching. And I would recommend that you stretch every day. Okay? That when you sit for a long period of time, or even when you sit in this room and listen to this lecture, some of your muscles, like your hamstrings, shorten as a result of sitting. If you sit in front of a computer for a long time, the same thing happens. So if you sit for a long time, when you stand up, you need to do something that's going to stretch the hamstrings. You need to stretch that muscle again out to what its length ought to be. Because sitting all the time, and you notice that people, you have shortening of muscles and it pulls you like this. Pulls you like this, as opposed to this. Okay? So you need to have the stretching as part of a good exercise program. Yoga is wonderful because it works on strength and stretching. So if I have a lot of balance problems, so I have a little problem doing some things, so I have to modify what I do. And that's what you need to do, whatever your physical problems might be. Talk with your doctor about what might you be able to do. And maybe you do need to hire a personal trainer to help you work out if you have something significant. As far as knowing whether you're where you kind of ought to be in terms of exercise, I want to make a recommendation to you. Invest in a little pedometer and see how many steps you take a day. Okay? And do this for like a week or 2 weeks. And just live your life normally and every day record how many steps you take. And then remind yourself what Jeanette told you in front of this class is that the current recommendation is 10,000 steps a day for good health. 10,000 steps a day. Okay? And then look at what you do, and then you'll know how you need to increase it. Okay? Most of you are not doing more than 10,000 steps a day. Trust me on that. 10,000 steps a day is approximately 5 miles of walking. And that means real walking. Okay? And so, you know, check yourself out. See what you're doing. And then maybe the next time you see your physician on a yearly checkup, ask them about how you might improve that, what you might do. Okay? All right. These factors decrease risk for late onset sporadic Alzheimer's disease. I mean, wow, guys. Wow. Okay? So, let's look at some physical benefits of exercise. Okay? I'm focusing on exercise because this is under your control. This is what you decide. Okay? Look at this. It increases endurance, strength, flexibility, balance, restful sleep, resistance to stress, cardiovascular fitness, and weight control. And it decreases risk for Alzheimer's disease. And it decreases risk for heart disease and stroke. This is really, guys, at the end I'll tell you it's a no-brainer. Oh. All right. Physical benefits of exercise, and it decreases hypertension, heart disease, type 2 diabetes, osteoporosis, and falls. One of the most common causes of diminished ability to enjoy life, if not death, in the elderly are falls. You fall, you get a subdural hematoma, and your life is changed forever if you live through it. Okay? If you have balance problems, this is an even greater risk. Okay? So you need to do something about it. And, you know, take control. Take control of your life. But, wow, look at that, okay? Cognitive benefits. Okay, this is the real message today. Okay? Cognitive benefits. Exercise is one of the only things that has been discovered that increases the generation of new neurons in the hippocampus. So there's a low level of what we call neurogenesis in the hippocampus. If you exercise, more are born. Okay? Even more importantly, more of them survive. So of the neurons that are generated in the hippocampus in everybody, very few of them survive. Most of them die. Turns out that exercise is one of the only things that has been shown to increase the survival of the neurons which are generated and the neurons which are already in the hippocampus that are older neurons. Okay? And it does this because exercise increases factors that keep neurons alive and increases blood supply to neurons, which is something else that helps keep neurons alive. Right? What happens when you cut off the neurons from blood supply? They die. Okay? So this is the cognitive benefits of exercise. It increases synaptic plasticity. People who exercise are better on tasks that involve learning. Okay? If you want to play the piano better, exercise before you sit down to play. Okay? All of these things are for a neuroscientist, I mean, this is great news for us. Okay? Production of neurotransmitters and substances that play a role in attention, arousal, mood, and well-being. So, guys, this course wasn't on this, so I didn't go into great detail about this, but one of the cognitive benefits of exercise is going to be a change in the neurotransmitters, which are the chemicals that are used to communicate between neurons. So there are particular neurotransmitters that play a role in attention. It's norepinephrine and arousal. Norepinephrine, if you care to know that. Mood is 5-hydroxytryptamine or serotonin. That's also the same neurotransmitter that's upregulated with drugs like Prozac. Okay? So guess what? Right there you know something. Exercise is currently being used as a treatment for depression. because exercise increases the very neurotransmitter that drugs increase. Now, it turns out that if you have really serious depression, exercise alone won't help you. But nonetheless, for mild depression, I want to put something out to you. In the elderly population, depression is very, very common, not necessarily because you have a mental disorder, but because being older and losing one's ability to do things, seeing your friends and loved ones die, seeing what lies ahead for you would depress any intelligent person. Okay? What Erik Erikson, the famous psychologist Erik Erikson, said that the last task that life presents us with is basically to choose between living a well and meaningful life versus despair. Whatever remains of our life, whether that's a week, whether that's a month, whether that's 5 more years of our life, or choosing despair, the last thing that life presents us is a task. And it's easy to fall into despair, particularly as you see people you love die, and you see your own abilities diminished. So you choose, and exercise will help you deal with that kind of depression, and also having strong social connections with other people of your age, where you have someone who understands what you're going through, someone you can talk to, and if you need to, a professional that you need to talk with. Yes?
Just curious.
Yes, a light box works with people with seasonal affective disorder, which is also a depressive disorder, yes. There are many different kinds of depression, and they can be dealt with in many different ways. So this would be mild depression of many different kinds, and exercise helps with that, okay? Let's keep the questions to the end period. That would be better, okay? So, well-being also, exercise increases endorphins. So it helps you deal with pain by stimulating a naturally occurring pain system in the brain that diminishes pain by stimulating pathways that are the same pathways that opiate narcotics interact with. So if you're in pain and you take a narcotic, it interacts in the brain in the same areas that a natural system exists, where you have your own endogenous substances in your brain that are putting out these chemicals. And so the cognitive benefits of exercise are enormous, in addition to the fact that it decreases Alzheimer's. So exercise decreases the age-related loss of neurons in the cortex, including the hippocampus. So an age-matched control that I showed you next to the Alzheimer's brain, that age-matched control, while it was much larger than the Alzheimer's, that age-matched control, it also lost neurons. Exercise helps mitigate against that. Age-related decline in cognitive performance. What did I say? Changes in the hippocampus in its volume are correlated with the changes that take place cognitively. Exercise is one of the only things that's been shown to reverse that or to stop it. Risk for Alzheimer's disease. So, all in all, this is a pretty good message today, I hope. Okay? So let's look at this again. You know me, I always have to review 18 times. I want to make sure nobody misses the gist of what was said today. Okay? Factors that decrease risk for Alzheimer's disease. And I'm going to do it again before we end. All right. Decreased risk. Let's look at it a different way. Not under your control. Okay? Let go of it. Choosing good parents. It's over. Okay? Not aging, it's over. Okay? You don't have any control over those. But look at this. Under your control. Your choice. You, the author of your own life. Continuing mental challenge, maintaining strong social and personal connections, eating a healthy diet. I recommend you stay close to the earth. That's how I put it. Stay close to the earth. Fruits, veggies, nuts, and whole grains. And that will help you maintain a healthy weight, but certainly maintaining a healthy weight is a very good thing, and physical exercise. Okay? So these are all under your control. And whatever you're doing now, every one of us, including me, can do more. Okay? Okay. Don't let this be your view of retirement. I'm a big dog lover. This is, you're looking at my 5-year plan, okay? And isn't that great? All right. So dog wisdom is important. So I asked my doxies what, was some wisdom I should give to you. And they always have an attitude and an opinion. If you've ever had dachshunds, you know that. So this was theirs, and that is, take it one step at a time. Okay? One step at a time. Talk to your doctors. Make sure that you're physically fit to change your exercise program. Some of the other things like mental challenge, you don't need to have your doctor's approval. They would approve anyway. You can do that yourself. But as far as exercise, because of risk of stroke and heart disease, make sure that you're in good enough shape to do that. And I am proud to say I have an older sister who is about 100 pounds overweight. She's about 3 inches shorter than I am and weighed 100 pounds more than I do. Okay? Developed type 2 diabetes and had 2 strokes. She has lost 75 pounds. Her diabetes is now, she doesn't need insulin. It's under control. She says she feels better than she's felt in the last 20 years of her life. Don't wait until you have 2 strokes. Don't wait. Okay? And lastly, it's a no-brainer. Okay? This is my no-brainer slide. You want to keep your memory intact, decrease your risk for Alzheimer's, exercise, challenge yourself, stay connected, eat your blueberries. Be alert and attentive to your emotional and mental needs. Seek help if you need to. And did I mention exercise? Thank you all very much. Thank you. The best thank you that any of you can give me is to change some aspect of your life because of coming to these 6 lectures. They've been on learning and memory. That's what you wanted to know about. That's what we've tried to do. You make one change in your life that is to your benefit in this way. That's your thank you to me. And I appreciate very much being able to come here for you. Now I want to open this up to general questions. The gentleman in the back who's had his hand up for a long time.
You said several times back that there isn't anything that you can't lose in your brain, and you alluded to the idea that there are some things that once lost might be regained. And what is that list of the things that might be regained? And are there any that once lost cannot be regained? Our narrative is my wife Carol has MS. And we have an exercise program for 2 years, and we are doing aggressive strength training because aerobics don't work very well because of the heat factor of MS. We work out, I'm her strength trainer, we work out with heavy lifts. We're not wusses at this, she's not a wuss at this. Sunday, Monday, Tuesday, and Wednesday, she goes to a group with a professional trainer on Thursday and Fridays a day for stretching only unless we're taking
Okay, okay. You're doing a wonderful job. So
what's happened though?
she's better?
After 2 years, the disability has decreased dramatically in all areas. Number 2, and we believe this is due to the exercise regimen that we've embarked on, her short-term, her near vision has improved on exam. Number 3, olfaction is improved, and within a matter of a week, the libido kicked in. Decreased risk, how important is it to have regular sex?
How important is it to have regular sex?
So anyway, that's our
I'm not sure which question he really wants me to answer, so I'm gonna approach this a different way. A disorder like MS, you have a demyelination of the axons of the areas of a neuron that connect to other neurons. Once that demyelination sets in, it can lead to obviously a slowing of what's going on, and you can also have the axon can die and then the neuron dies. So for most areas of the brain, once those cells are gone, they're gone forever. Now, having said that, there are many connections that we have that can be called into play under certain circumstances. So we say, neuroscientists talk about what we call silent synapses, in that there's many more synapses. There's a great deal of redundancy, I guess is what I'm trying to say. So if you have a disorder and you fight against it by something like exercise, you're calling into play some of the redundant pathways, and so that's good. The second thing that's important is that if you have no disorder like that, if you don't have a disorder like that, taking control of your life makes you feel that you have some control over what's happening. When a person has a disorder like MS, being actively involved in doing something that is positive towards helping you elevates mood, helps with sex desire, all the rest of this, helps that person, because think how helpless it feels. Also, that person is also aging. So the exercise and everything is not only helping with the disorder, but it's also helping them against the aging process itself that would be taking place anyway. So again, under the advice of a physician, some of these disorders we believe, and this is also true of Alzheimer's disease, they're starting now, if they identify people with mild cognitive impairment, there are physicians who now have their patients on pretty rigorous exercise programs in the attempt to slow the progression of what is happening. It is not going to hurt the person, you know, as long as they don't fall and get a fracture or whatever. I have a friend who has multiple sclerosis. She lives in Atlanta. She teaches a yoga class from a wheelchair. And she's always been athletic. She was a runner and an athlete when she was younger, developed MS. And I've seen her progress very slowly from being able to walk to now being in a wheelchair. But she doesn't let it stop her. It doesn't let her stop her. How much sex you need to, you know, I really shouldn't answer that one. But I will say this. One of the good things that sex does if you're in a good relationship is it keeps that bond strong between yourself and another person. And that bond is important. It doesn't matter what age we are. That bond is important. And so I think it's a very healthy way for people to show affection for one another. So I'm all for it. Okay.
I was told at some point that the area of the brain that for music and learning a new language, for instance, is most receptive or open from age 7 to 12. So that you get your kids involved at that age and they learn a language much easier.
Oh, well, there's no question about that.
So what area of the brain is that? That's question one. And two, is it realistic at this age to take on learning a brand new language?
Absolutely. Okay, so the only thing I have an objection to is that the areas of the brain that allow you to learn a language, whether it's your first or second language, are most plastic when we're young. So most linguistic authorities say that whatever languages you learn before the age of 12, you will always be more fluent at than anything you learn after that. Noam Chomsky is an example. There are people who speak 11, 12 languages, and people who are fluent in these languages normally learn them before the age of 12. Like I said, the people in New Guinea, there are individuals who speak 15 languages. These are individual languages, distinct languages. And they have no trouble at all, and they never even went to college, okay? Now, second language acquisition when you're older involves different areas than first language acquisition, no matter how many of them there are. So if you learn 2 or 3 languages when you're 4 or 5 years old, those are still kind of your first languages if you practice them enough. I mean, if you're truly fluent in them. When you're older, those areas of the brain actually aren't the ones that are involved in learning a language. And language areas and music areas are very close to each other and tightly interconnected. Music is a language. It is a language. Okay? It's just a different kind, but it is a language. If you were to read something off of a piece of paper, we consider that a language skill. Well, when a musician looks at notes on a page, they read them. Okay? It is a language. If you learn things as you're older, will you ever be as fluent as a child who's 2 years old who hears their parents speak a native language? No, you're never going to be as fluent. But you know what? Wherever you're at, you can improve. You can get better. So what we're trying to do is provide the brain with challenge, and this just underscores that that is a challenge. To even be able to make the sounds with your mouth or take up a musical instrument at my age would be a real challenge, particularly for the teacher. Hey, I took my first golf lesson yesterday, okay? Woo-hoo-hoo! Okay, I know about challenge to teachers as she stood there, you know. Actually, I hit the ball every single time. I think that was good, okay? And sometimes they went straight, and sometimes they went that way, and sometimes they went that way, and sometimes they went that way, and sometimes they went that way. But I did hit it, okay? So the teacher said, you know, that's the first thing, you know, okay? All right. So, am I ever going to be Michelle Wee? No. Does it matter? No, because I plan on playing golf with people your age who play at my level, okay? So it doesn't make any difference. But you are correct. There is no doubt that overall, in every way, the young brain is more plastic than the old brain. Okay?
Do you ascribe to the Rosetta Stone?
I think that you can do Rosetta Stone, you can do anything. I think Rosetta Stone and some of these others, there's another one out that I've forgotten the name. There you have it. You know, I've never used it. There are multiple programs out there. I think what matters is that the best thing you could do would be to take a class with a native speaker of the language who can correct you, particularly in pronunciation. As an adult, your pronunciation is going to be terrible. And so a good teacher is very good at that. It's like taking piano lessons when you're older. Could you teach yourself? Yeah, you can teach yourself, but you know, a teacher can help you a lot. And somebody who's patient with an older person. The chairman of my department took up piano at 71 or something like that, and he said his teacher told him that she'd never known anyone who had less talent. And the chairman of my department, I would like to say, was a world-famous embryologist who was chairman of a department in a major medical school. He was incredibly intelligent, but he said he just didn't get it with music and about translating what he saw on the page to his fingers. And so I said, do you care, Jack? He goes, not really. He said, I'm having a ball. Okay? And he was playing little kiddie tunes, and he thought it was the best thing that ever happened. So, you know, it's all what you take your enjoyment in. If you think, guys, if you haven't learned by now to let go of this competitiveness that we have to be Michelle Weir, we have to be a concert pianist, let go of it. We're past that stage of our lives. So we should do what brings us enjoyment. We all agree on that? And do the best we can. Okay? Do the best we can. Question?
You mentioned having an issue with balance, which I share, but you talked about yoga helping. Would you elaborate that on that?
Well, yoga, so, you know, you have poses. You have poses, and that helps stretch the muscle, but many of those poses involve movement in a way that for someone who is balanced, you have problems, okay? So either you don't do that particular movement, or you modify it. So if you have something that would normally, now see, right away, the balance problems. Something that would normally require for you to have both of your feet together like this, you modify it by giving yourself a broader stance. And there are a few of you who work out in the same facility that I work out in, and if you ever see the trainer work with me, when I get down to try to work on my balance, the closer together my feet are, the more imbalanced I am, and it's all I can do to keep from falling over. And so I move my feet apart to give me a wider balance stance. And so you notice as I teach, I normally don't stand with my feet together, and that's because my balance is off. So you learn to do these various things, but it doesn't keep me from doing what I need to. For myself, I fell, as a professor at Vanderbilt, I fell almost a dozen times going upstairs. And this is how they discovered that I had a lot of these problems. And I hurt myself very, very badly on a couple of the falls. Falling upstairs does funny. I broke off, you know, the ends of my 2 front teeth, you know, things like this, okay? Racked out my shoulder, fell and hit both kneecaps on metal stairs and let out a shriek that could be heard 5 floors away. What they've really worked on is making my ankles and my core stronger so that if I fall, I can get up. So I had a problem that I fell a couple of times and I didn't have the strength because I'd injured myself. I didn't have the strength to get up, which is very dangerous. And so it's very important that you do, given whatever problems each of you may have, that you do the best within that, okay? And am I ever going to be a high wire artist? Probably not, okay?
Thank you. Other than, you spoke on the question of risk factors for Alzheimer's. Other than hormone replacement therapy, are there other drugs that can negatively affect, I mean, that are risk factors?
Not that we know of. Not that we know of. There may be, but not that we know of, okay, or not that I'm aware of. There are lots of changes going on in the Alzheimer's brain. So, for example, there's an accumulation of metal in the brain in Alzheimer's disease, of certain metals, and a decreased amount of other kinds of metals in the brain that are necessary. So we have, you know, copper in our brains, we have iron, we have some of these other things. The Alzheimer's brain has an abundance of, like aluminum, has 30 times the amount of aluminum that a normal brain would have. And it used to be thought that this caused Alzheimer's. Now we don't believe that. We think that aluminum gets into the brain in extraordinary amounts because of other changes that take place. So, you know, when you use most deodorants, processed cheese, bread, cooking with aluminum pans, drinking out of aluminum cans, drinking drinks that strip plastic off the inside of aluminum cans, you know, people say, well, we ought to decrease like aluminum salts that are used in various things but we now think it doesn't cause Alzheimer's. It's that the brain is constantly being bombarded, and if other changes go on, it lets the aluminum in. So if you don't get Alzheimer's disease, you're probably fine in using these things and drinking out of aluminum cans or whatever. At one time, by the way, Coca-Cola actually thought about completely eliminating cans, because Coke is one of the things that can strip plastic off the inside. You know, most cans are coated with plastic on the inside, guys, and we don't know what the role of that plastic is in various disorders, but nonetheless. So acidic drinks and other kinds of things can strip that plastic off the inside of the cans. They thought about going back to bottles, but in fact, because we now no longer think aluminum causes Alzheimer's, they decided not to do that. Yes?
I have a question. The answer may not be important, but I'm really curious. Go back to the hippocampus, and you said where there's no neuron, we get no new neurons being created. And my question is, where does it come from? What
okay, so yes, so you have new neurons being generated in your liver all the time. You have new neurons, not neurons, but new liver cells generated in your liver all the time. You have new skin cells being generated in your skin all the time. So there are stem cells that are still present in your brain. So your brain develops from stem cells that are located near the cavities in your brain, and they undergo mitosis, so they divide, and then you get more and more and more and more and more. And the stem cell guys are there, but normally this is inhibited in the adult brain. So most areas of the brain, you do not generate new neurons in your life. So neurons are called post-mitotic. So that means that once they've undergone their birth and migration and everything, they do not divide. That's why, guys, brain cancer, tumors in the brain, inside the brain substance itself, are not tumors of neurons, because neurons don't undergo mitosis. Tumors in the brain are made up of what are we call glial cells, which are other kinds of cells in the brain that undergo mitosis throughout life. So neurons don't undergo mitosis. So the only time you see neuron tumors is in infants and children, when they're generating all their neurons and everything. Does that make sense to everyone? So once a cell is mature and it's not ever going to divide again, then it's never going to undergo like weird cell division either, okay? So the hippocampus is one of the few areas that has what we call a germinal zone that is capable of producing new baby neurons throughout life. Wow. Wow. Okay? Yes.
Is there any validity to increasing tumor in your diet for Alzheimer's patients?
Oh, turmeric, yes. You know, lots of anecdotal information, but I don't know of any scientific studies. I don't know of any. Yes?
Could you talk about the reason that Alzheimer's patients respond to music? Maybe they were previous music.
Yes, okay. If you think about this, you know, this is the funniest thing. Okay, so the other day I'm in the exercise facility and they've got this oldies music playing, and there was a song that came on that I'm certain that I haven't heard in at least 40 years. Man, right away I was singing along with it. The words, the music, the rhythm, everything, okay? This is part of long-term memory. With Alzheimer's patients, people who don't have any language, like they can't communicate with their loved ones, you can get them to start singing Jingle Bells. Now, it doesn't mean they know what that means or whatever, but it means that rhythmic memory in that song has been ingrained. And they actually use this kind of therapy to help stroke patients learn how to talk again. It isn't going to help the Alzheimer's patient, but in people who've had stroke, who have trouble getting words out and everything, they'll often get them singing and they'll do Jingle Bells or something else like that. It's not going to be a new song they've never heard. But I couldn't believe, I hadn't heard this song in about 40 years on the oldies stand, and I'm starting to sing along with it, and my trainer, you know, he was laughing because he's so young he didn't even know the song. But it's ingrained in there somewhere. When I was young, I heard it so many times that memory is still there. Still there. Yes?
When you talk about alcohol?
Alcohol. Okay, alcohol. It's like that question, how many times a week should you have sex? Okay, so alcohol. Alcohol kills neurons. Okay? Alcohol kills neurons, guys. I worked in a research lab. You have a dish of neurons and other cells in the dish. You want to kill neurons, you dribble some alcohol on it. You can dribble monosodium glutamate on it. Don't eat foods with monosodium glutamate on them. Okay? You can dribble it on the neuron. Yeah, it kills the neurons. Okay? Having said that, you have a lot of neurons in your brain, and also low levels of alcohol probably, you lose neurons every day anyway. You know, everything in moderation. The other thing that you need to be aware of is that individuals who are like winos, I'm not purporting that anybody ought to do this, but individuals who are alcoholics who primarily drink wine generally have really clean arteries. Now, they can't walk straight, think straight, or do anything else, but their arteries look good. And this is the kind of thing about the red wine, you know, having a glass. I don't think having a small glass of red wine with food is going to do anything deleterious to you. Never drink and drive. because everything is diminished. I mean, so be very careful of that. Drink, many cultures, people have what are called table wines. They have really low level of alcohol, but they have the positive benefits like of the flavonoids and everything that are in the skin of the grape. So there's your positive thing, like in red wine, it's the skin of the grape that has the flavonoids, and it's not the alcohol that's helping you. And so if you drink wine that has a low alcohol content, red wine, with a meal, you're probably not doing anything bad to your brain. Over abuse of any of these things is very, very bad for your brain. And for most areas, there's no coming back from it. Okay, yes?
How much does a medication that, for example, if you're on the rest of your life, how much would that affect your brain?
Well, I think different medications affect the brain in different ways. We don't have, remember, for a lot of medications, this is my last question, I'm sorry. For a lot of medications, we have no data that tells us what the long-term effects are. When the FDA does trials, a long-term trial could be 6 weeks. They might call that a long-term, and that drug might have only been tested on rats and maybe never taken to primates. Okay? And so we don't have a lot of data on a lot of drugs. The minute they get reports that a drug is very dangerous for someone long-term, it gets pulled off the market. I mean, this is a process that we undergo in trying to approve drugs and everything. So I can't really answer your question. It depends on the drug. If it's something that changes something in your brain, it certainly is altering the brain. And we certainly do know from non-prescription social drugs that you can damage your brain permanently by taking them. Like cocaine is an example, okay? Ecstasy is an example. Methamphetamine is an example. These are just drugs that affect the brain too. And so my recommendation of medications is you don't take it unless you need to. If you do, talk with your doctor about the minimum amount that you need to make the change that's important for your life for the shortest period of time. I mean, does that make sense to everybody? And to explore alternative ways of dealing with pain or dealing with depression or whatever, but always under the supervision of your physician. You all get an A. Thank you. Say bye-bye to Fred.